According to the CDC, the leading causes of traumatic brain injury in the American civilian population are falls, motor vehicle traffic crashes, struck by or against events, as in sports-related injuries, and assaults, including domestic violence. Falls make up the largest proportion of TBIs, with the highest incidences in children aged 0 to 4 years and adults over the age of 65. Firearm use is a leading cause of TBI-related deaths, but motor vehicle traffic crashes result in the greatest number of TBI-related hospitalizations. Males are 1.5 times as likely as females to sustain a TBI. Other high-risk groups include African Americans, American Indians, and Alaska Natives. Recent estimates indicate that 20% of all active-duty military personnel in war zones sustain mild to severe TBIs due to blast and vehicle injuries. Primary care providers will want to include brain injury in the differential diagnosis of patients in high-risk groups who present for medical care, reporting any cognitive, emotional, or personality changes, whether or not head trauma or a history of concussion is readily apparent.
Kids of any type are vulnerable, again, just because they're out there doing goofy stuff and things that adults would not do that put them in harm's way in terms of getting a traumatic brain injury. People in high-risk occupations, firemen, policemen, our military. Again, I would think that people in those occupations, as well as athletes, both amateur and professional, should probably get a special question about brain injury, or a little more questioning about brain injury when they come into the office, because there's increased risk. Probably the last group that is vulnerable are the elderly, because of the propensity to fall. And some of the other disorders that you may be aware of, like variable blood pressure or dementia, again, would be signals that they may be more vulnerable to fall, and probably good to ask them about that as well as a family member, since in this population they may not always remember if they fell or if it was serious.
Individuals who would be at greater risk for developing significant post-concussive symptoms would be those individuals who've had a prior traumatic brain injury, people with prior histories of anxiety and depression or post-traumatic stress, and individuals who have not received appropriate education about the expected time course and improvement of their symptoms.
Oftentimes folks will, come into an emergency room after a car accident. They have lots of broken bones and other injuries, and we forget about the mild traumatic brain injury. On our inpatient services, oftentimes we'll see somebody who's had a devastating spinal cord injury and they're paralyzed. Of course, that's devastating. But oftentimes they've had a mild traumatic brain injury.
It's very common for concussion to be not adequately evaluated in the emergency room.
They can also be people who were sent home from the hospital or from rehab without adequate follow-up. These are people who do not begin to associate difficulties they have in functioning with the brain injury they sustained.
But those same injuries, same people may wander back, and hopefully will wander back, into their general practitioner's office or their family practice physician's office, and maybe reporting symptoms, that weren't recorded in the emergency room. Important to take those at face value. Important to evaluate the history, as we do with any disorder, and connect the dots. If those symptoms seem to have started when the person had their concussion, good chance they were due to the concussion.
All polytrauma patients should be screened for traumatic brain injury to ensure that they are getting the proper aftercare following a major accident.